I'm Captain Stacy Gerlich. I am the commander of the CERT Community Emergency Response Training Program for Los Angeles Fire Department. And today we're standing in the warehouse for the California task force team, the FEMA task force team. So that's why you see all of these boxes and things around us, which really doesn't matter because you never know where you're going to be when a disaster happens. What I have with me today are my PPEs, or personal protective equipment, and my BSIs, body substance isolation. That consists of goggles for my eyes, a dust mask to protect my airway, and a pair of vinyl gloves for my hands. What we're going to do for you is we're going to go through the head to toe full body assessment. Where we're standing is in the immediate treatment area. So no one gets treated until everyone has been triaged. So this patient that we're here with right now has already been triaged. They're in the immediate area, and we know that because they're in the red tarp, or on the red tarp. So when you approach your patient, try to approach them from a position that they will see you coming. If your patient is awake, remember that under the Good Samaritan law, you need to ask their permission to treat them. So you introduce yourself and say, "Hi, my name is Stacy. I'm trained in first aid. Can I help you?" If the patient is awake, more than likely they will consent. If they are unconscious, it is implied consent. And if they are incapacitated, it is implied consent. And if it's a minor and there's no parent or guardian, it also falls under implied consent. So I have my gloves on, as you can see, those, and my goggles, my body substance isolations. I'm not wearing my mask so that you could hear and understand what it is that I'm instructing you on today. So I'm going to come up here to the head of this patient, and I'm going to put my hands on the sides, and I'm going to feel for any abnormalities, any lumps or bumps, and I'm also going to be looking for any bruising or discoloration. Take my thumbs and gently press down on the forehead, checking the integrity of the bone structure here of the face. Also the cheekbones and the lower jaw, using my thumb and fingertips. Again, if I'm feeling a lot of movement in the cheek area, I should be concerned with the potential airway problem because there's probably going to be internal bleeding. So just pay attention and watch the patient's airway. Okay, so now I'm at the eyes, and what I want to do is I want to look at the size of the pupils. Now, if you need to lift the upper lids, that's okay. Just don't stick your thumbs into their eye sockets, okay? You're going to check to see the size of the pupils. If one is larger than the other, that's a pretty good indication of a head injury. There's nothing you can do at this point, but remember, documentation is very important. We're going to come down, we're going to look into the nose, and we're going to look into the ears without manipulating the head, and we're looking for any blood or clear fluid. Blood is blood, clear fluid could be cerebral spinal fluid. When there's a fracture at the base of the skull, it will come out either the nose and or the ears. We're going to take one hand and gently feel the back of the neck, and now we're feeling to make sure that the spine is in line. So at this time, it's a good idea for you to reach back and check yours and see what it feels like so you know what normal really is. Come around, take your hands, and you want to cup the shoulders. You want to make sure they feel equal and that they're not moving in places where they shouldn't be. You're going to take a quick look at the neck in the front there because you're looking to see where the Adam's apple is or where your trachea lies, and it should be midline in the middle of your neck. If it isn't, it's a pretty obvious thing that you'll notice that it's off center. Okay, slide over to one side a little bit, and what you're going to do now is you're going to take your thumbs and gently press on the collarbones, again feeling for the integrity of the bone structure there, and you're going to take both your hands and squeeze on the upper arm. Now remember, I'm going to lift this up for you. You have one bone in the upper arm and you have two in the lower. Now you need to squeeze hard enough to actually feel the bone structure. And while you're here, go ahead and do capillary refill because it will tell you what's going on with the circulation to that limb. If you can comfortably reach over, go ahead and do that. Squeeze the arm again as I stated on the other side, and then check your capillary refill. Now you're here at the chest. And in order for you to assess the sternum or the breastbone, you want to use the little finger side of your hand, and you want to press down, not too hard, but hard enough to kind of feel the springiness of the chest itself. Also pay attention to what's happening with your patient here, because even if the patient is unconscious, they can respond to painful stimulus, and that's important for you to document. with both hands, one on either side, close up into the armpits. You're going to push in as you move down to about the level of the belly button, because this is where your rib cage ends. Same thing now, you're looking to see if there's any reaction from your patient. Now you're in the abdominal area. One of your important landmarks is your belly button. So on a real patient, you're not going to be lifting up their shirt and exposing them. However, I want you to understand it's important because you visualize in your mind where the belly button is. You draw an imaginary vertical line and an imaginary horizontal line through the center of the belly button. You've now divided the abdomen into 4 equal parts. You have 2 upper and 2 lower. Put one hand on top of the other, mindful to use your fingertips because you need the dexterity for feeling and assessing. It doesn't matter if you start away from you or close to you, whatever is most comfortable. You're going to push down with your fingertips and you're going to cover all 4 quadrants of the belly. And what you're noticing here and what you're trying to pick up on is, are there any masses? Like maybe there's an organ that's been affected. Is there rigidity? Like when you're in a half sit-up position, your stomach's real tight. That could be a good indication of internal bleeding. Distension like a watermelon. Again, later sign because it takes a while for the abdominal cavity to fill with blood, but certainly that could happen. So these are the things that you want to document. As you move down, now you want to take the palms or the heels of your hand and you want to find the hip bones. You want to push in or squeeze on either side. And again, you're testing the integrity of the pelvis. And then bring the heels of your hands so that they're on top of the hip bones and you're pushing down from above. And a tiny little rock here is good. Now, most often when there's a fracture of the pelvis, you're going to get it around the pubic area because there's cartilage that comes together. And it's common for that to separate. So when you're pushing down from above, you may feel a little bit of a give. And again, you're watching to see what's happening with the patient and you're documenting this. You kind of slide down, you've got your lower extremities. You're going to squeeze hard enough to feel the bone structure. Now remember, the femur is the largest bone in the body. So you have to push with some pressure. You have 2 bones in the lower leg, so you want to, again, squeeze hard enough. So if you're suspicious of a fracture in the leg, whether it be upper or lower, if you can take the shoe and sock off without a lot of manipulation, you can check the capillary refill on the big toe. You want to come over and do the same thing on the other side. And if they're awake, go ahead and ask them if they can wiggle their feet, because that tells you about what's going on with the pulse, the motor, and the sensory involvement with this particular patient. Okay? So now we've completed the head to toe, but the one thing that we haven't done is the back. So if you're highly suspicious of a neck or back injury, then you obviously are not going to want to roll this patient. So if that's the case right now, what we would do is we would slide our hands up underneath the torso and try to get to the center of the back, and then go on the other side and you would do the same thing. Okay? And when you take your hands out, you're looking for any blood, and while you're under there, you're feeling for any sharp objects. So let's say now that we are not suspicious of a neck and back injury, and we're going to roll this patient over to check the back. So the proper way to do that is you would take the arm that's closest to you, you would put it up over the patient's head, you would take their other arm and cross it over their body, and then you can cross the outer leg over the inner leg, again, if you don't suspect any involvement in that lower extremity. And what this does is it gets the body momentum going in the direction that you want to put this patient. So, hand on the shoulder and a hand on the hip. Leave yourself enough room away from the patient so that when you actually roll them, you're not rolling them on top of you. And gently, you roll them up just enough for you to assess the back. So you can run your hand down the back and you can take a look to see if there's anything that you may have missed when you were doing your initial assessment. Put them back, put the arms down, bring the arm that you put up back down to the side, and this is all about comfort of the patient. And this would complete your head to toe survey. Okay, so before we go to the documentation, I want to show you how to properly take your gloves off that are soiled. You want to grab around the wrist area of one glove, and you're basically going to turn this inside out, as such. You're going to roll it up in the gloved hand, and then you're going to take your ungloved hand and come underneath the wrist, okay, so because you're now against your body, so it's nothing that's contaminated. You're turning this inside out. The gloves are inside out, and all the bad stuff is inside. And you should properly dispose of this in a biohazard bag, which is red, or if you don't have that, in your CERT kit, you should have some Ziploc bags so that you can put all of those soiled bandages that you've used until you can properly dispose of them. If during that head-to-toe survey you find something such as a potential fracture or dislocation, you need to document all this information. You're either going to do it on a triage tag, or you're going to do it on a piece of tape or shipping tag or a piece of paper, anything that you have that's going to stay with the patient. Now, we train you to work with a partner. So in reality, while the one person is doing the hands-on head to toe, the other person can be taking these little notes as you go along the way, because sometimes there's a lot going on and it's difficult to remember what it was that you found. But in the event that you didn't have that available to you, now you go back and you write these little notes down. So, possible fractured left arm, possible fractured left leg. This doesn't have to be a dissertation, okay? It's just a small note to remind you that when you're ready to go back and do the splinting and the bandaging, now you know where to go for that. Okay, so now what I'm going to do for you is I'm going to demonstrate the head-to-toe survey in the time frame in really which you should be doing it, and that is 60 seconds or less. Okay, so this takes time for you to get this, okay, so don't worry if it doesn't look the same when you do it, you'll get it. All right, so I'm here at my patient, and for purposes of the video for you, the patient is unconscious. I'm not going to introduce myself. It's implied consent. I've got my body substance isolation on. I've got my gloves and my goggles right now. I'm purposely, again, not wearing the mask so you could hear me. I start up here at the head. I'm going to feel for any lumps and bumps and things that shouldn't be there. I'm going to gently press down on the forehead for the integrity, the cheekbones, and the lower jaw. Again, feeling for anything that's moving that shouldn't be. I'm going to check the pupils for the size, making sure they are equal. I'm going to look into the nose and the ears for any blood or clear fluid. I'm going to gently feel the back of the neck, making sure it's in line. Check the midline of the trachea, the windpipe. Slide around. So I'm facing my patient. Gently cup the shoulders, taking my thumbs and feeling the collarbones, the sternum or the chest bone. I'm feeling the rib cage, the abdominal cavity, the extremities, capillary refill, the pelvis, the lower extremities, capillary refill on the big toe, and the back. Now, if I can roll the back, I'm going to do that as I described. Hand on the shoulder and the hip. I'm going to gently roll them up. And I'm going to check the back for anything that shouldn't be there. And then bring them back down and into the position that they were in. And that should be the way in which you're going to do that 60-second full body evaluation.